If your blood pressure is suddenly high, do these 7 things. You check your blood pressure and it's 160/90. Immediately you think something is wrong. So you check it again and again. And now your blood pressure is not the only thing going up. Your anxiety is too. So what should you actually do when you suddenly get a high blood pressure reading? Give me the next 8 minutes to explain. I'm going to show you exactly what I want people to know when the number suddenly looks scary. And number 7 is especially important because there is a point when a very high blood pressure should not simply be watched at home. Hi, this is Dr. Gani. Let's start with number 1. Don't panic over one reading. First, one blood pressure reading that is high, it doesn't tell the whole story. Blood pressure is not a fixed number. It changes throughout your day. Stress can raise it. Walking can raise it. Exercise can raise it too. Also, pain can raise it. Caffeine can temporarily affect it. And even getting nervous because you saw a high number can potentially make it the next measurement higher. So instead of immediately checking it 5 more times, stop, sit down, and let's measure it properly. Number 2, wait 5 minutes before repeating your blood pressure. Sit quietly for at least 5 minutes. Don't talk, don't scroll through something stressful on your phone, don't walk around the house. Just sit. Why? Because we're trying to measure your resting blood pressure, not the blood pressure you had while rushing up the stairs or arguing with someone on the phone. Then check it again. Number 3, check your position. This sounds incredibly simple, but positioning matters. Sit with your back supported, put both feet flat on the floor, don't cross your legs. Your arms should be supported, not hanging in the air, and the cuff should be approximately at heart level. Put the cuff on your bare arm, not over your sweater, and make sure you're using the correct cuff size. Small details can affect the accuracy of your measurement. This is exactly why I tell people, before worrying about the number, make sure you can trust the number. Number 4, take 2 readings, not 10. Once you're rested and you've positioned correctly, take 1 reading, then wait about 1 minute and take another. Write them down. What I don't want you doing is check, 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 every 30 seconds while becoming increasingly anxious. Because blood pressure is information. We're trying to collect good information, not chase the perfect number. Number 5, ask what happened before I checked it. This is where you become a little detective. Ask yourself, did I just exercise? Did I run up the stairs? Did I have coffee recently? Was I rushing? Am I in pain? Am I particularly stressed or anxious? Did I smoke? Do I really need to use the bathroom? Because these things can affect your blood pressure readings. So if you checked your blood pressure immediately after walking quickly through your house and you got 145, and then after resting correctly you got 125, those readings were taken under completely different circumstances. And that context matters. Number 6, look for a pattern. This may be the most important lessons in this entire video. Don't become obsessed with one number. Look for the pattern. If appropriate for your situation, check your blood pressure under similar resting conditions and keep a log. Write down the date, the time, the readings, and perhaps anything unusual that was happening. Then bring those numbers to your healthcare professional. Because one blood pressure is like a photograph. A series of properly measured readings gives us much more of a movie. And sometimes people have normal blood pressures at home, but higher reading in the doctor's office. That's often called white coat hypertension. Other people may show the opposite pattern. That's one reason home monitoring and sometimes a 24-hour ambulatory blood pressure monitor can be so helpful. Number 7. Now when a high number is different, no, we need to talk about something important. There is a difference between my blood pressure is a little higher than usual and my blood pressure is extremely high and I may be having symptoms of an emergency. If your blood pressure is higher than 180 systolic and or 120 diastolic, wait at least 1 minute and check it again. If it's still high, you need proper guidance from a healthcare professional. If a blood pressure above that level occurs with symptoms such as chest pain, shortness of breath, back pain, numbness or weakness, vision changes, or difficulty speaking, that can represent a hypertensive emergency. What do? Call 911. Don't sit at home checking your blood pressure 20 more times waiting for the number to come down. The biggest lesson. So let's put everything together. You check your blood pressure and it's unexpectedly high. What do? Don't panic. Rest for 5 minutes. Check your position. Measure correctly. Take 2 readings about 1 minute apart. Think about what happened before the measurement. Write your readings down and look for a pattern. Most importantly, know when an extremely high blood pressure, especially with concerning symptoms, is no longer something you should simply monitor at home. Here is a sentence I want you to remember. One blood pressure reading is information. A pattern tells us much more. You don't need to fear your blood pressure monitor. You need to know how to use the information it gives you. If you know someone who checks their blood pressure at home, send them this video. It may save them a lot of unnecessary anxiety and may also help them recognize when a reading really does deserve attention. This is Dr. Gani, wishing you good health as always.